talking all about mistletoe, and we're just going to wait 1 second and wait for Dr. Timms to log in. Let's see here. Hi, I see people joining in. Let me see. Hi, Jackie. Let me get Dr. Lucas in here. Oh, hi, everybody. So good to see all of you guys waving and being a part. Let's give them 1 minute here. I'm excited. Today is Believe Big's birthday. Today we are actually turned 12 years old. We are so excited that you guys are a part of our Founders Day and able to join us today as we talk all things mistletoe. And here we go. Let's add him in. All righty. Let's see if we can get his. There he is.
Hey, Ivelisse.
How are ya?
I'm doing great. How are you?
Good, good. Well,
Can you hear me all right?
We can hear you great. We can hear you great. Thank you for joining us today on Founders Day to talk all things mistletoe.
Nice.
I have
Props.
my little mistletoe prop. We haven't hung it in our house yet, but hey, quick fact for everyone who's listening. The mistletoe that is used for cancer treatment is actually the mistletoe with white berries. So I don't know if people knew that, but just wanted to share that with you all, a little quick fact. Thank you for joining us. Dr. Tim is one of our amazing practitioners that is one of our favorites, and he always has such great information to share on our podcasts and also with his patients in regards to cancer treatments. He knows everything mistletoe, and so between he and I, we're going to answer the questions that you guys are asking. And so if you guys can post those questions that you have, there's a little chat box in there. You can send in your questions, and we have a few of them from some of you that have already done so through our stories and things like that. So let's get started with the basic questions here. If people are typing their questions in. Okay, here's one. This one is from someone watching right now. Is sub-Q mistletoe as good as IV mistletoe?
That's a good question. My answer to that would be it likely is in most situations, but there are some areas where IV seems to be superior. And I would say, generally speaking, the more advanced the disease, the more IV is going to probably have more benefit.
Yes, yes. You know, back when I had cancer in 2008, we didn't have the IV available, and
Right.
I used the sub-Q, and still what I use today, but so grateful that the IV is available, especially for the later stage patients now, and to kind of settle things down some.
Absolutely.
Okay, so here's a question. How do I know if it is best for me, and does it pass through the blood-brain barrier?
That's a good question. We don't have great data or evidence on its ability to cross the blood-brain barrier. The best that we have says it likely does not, but that doesn't mean it can't be helpful for things going on in the brain. And what I mean by that is what we see with mistletoe therapy and a lot of what we would classify as immune-based therapies is that even though the extract itself is not physically present in a certain tissue, doesn't mean it can't inspire an effect in that tissue and have a systemic effect. Even though you may be, like with the subcutaneous injections, you may be injecting that medicine directly into the abdomen tissue, but it's exerting effects all over the body by way of stimulating the immune system, which is everywhere in your body.
Yes, yes, I agree. Someone's asking right now, what does the research say about the effectiveness of mistletoe in the stage 4 hormone-positive breast cancer?
Well, speaking from my experience, I've seen it be a very helpful tool in women with stage 4 or any sort of advanced stage breast cancer, hormone positive or not. what's great about mistletoe and all of these immune-based therapies is it's teaching and telling and stimulating your immune system to deliver the desired effect. And so your immune system is so well equipped and able to respond to any foreign type problem that comes its way. And so whether it's a hormone driven cancer or a triple negative breast cancer or a cancer that's being driven by something else, if you get the right mistletoe, the right variety for the right patient, it's going to have the desired effect no matter those things.
Yes, yes. And explain to people the differences. I know that, you know, it's not like a supplement that people can just take 100 milligrams of this dose. Explain
Right.
why it's such a delicate dance with what type of mistletoe to prescribe and how the dosage is different for each person.
Yeah, that's a great point to bring about, Ivelisse, because most of the time when we're talking about cancer treatments or any sort of therapy, we're talking about, you know, how does it fit the disease? And with mistletoe, we're talking about how does it fit the individual? Okay. And so, as some people may know, there's lots of different varieties of mistletoe, different preparations based on different host trees. And, you know, what the experience has been with mistletoe and learning from people who've been doing this a lot longer than I have is that you want to match the mistletoe to the person and not to the disease.
Mm-hmm.
And so that's where we look at more terrain-based testing, obviously the constitution of the patient, their history, how they're presenting, their symptoms, versus what we see on the pathology report, if you will.
Yes. Yes. Now, is it safe? Here's a question from Caitlin. She wants to know, is it safe to have mistletoe IV infusions the day after chemotherapy?
It is, barring a few things. Chemotherapy in and of itself is not a contraindication for mistletoe, but complications of chemotherapy could be things that may require you to take a pause from your mistletoe. Very high fevers, which usually you don't see immediately after chemo, but if you are, you know, having a very high fever, that might be a reason. Or if you have any concern of an active infection, or if, you know, certain blood parameters are showing signs of concern, a very high white blood cell count, high eosinophils, or a high neutrophil lymphocyte ratio could also be reasons why you may want to pause. But just it being the day after chemo is not a reason why you need to hold it.
Okay. All right. And here's another question. I get this question a lot, and my husband's one of them that wants to be on mistletoe. And so, can mistletoe be used preventatively?
I believe it can be. We don't have as much in the way of trials looking at it in that phase of things, in terms of whether it's primary prevention of cancer or even secondary prevention of cancer. But in my mind and in my experience, it may be the best thing you can do from a prevention standpoint, because if we think about how cancers come about, it's usually always due to the fact that the immune system is not behaving correctly.
Right.
And so, you know, obviously, you know, eating a healthy diet, exercising, sleep, managing stress well, avoiding toxins, those things all help to make sure your immune system is working well. But mistletoe is just one more layer on that, on that kind of pile of things we can do that gives us that extra bit of protection. So whether it's, you know, you've got a strong family history or maybe some other predispositions for cancer risk, I think mistletoe should absolutely be considered as a tool for prevention.
I'm glad you shared that, because actually all my kids do a preventative mistletoe
Right.
with the Lynch syndrome that I have. And, you know, just knowing that they're getting something, they do a series once a year. They do the A, which is the mildest.
Yes.
And they do that once a year in the summer. And it just helps to make sure their immune system is alert and awake. And so I'm glad you shared that.
Absolutely. And I think it's important what you said. It's, you know, the mistletoe and the approach that we might use for prevention probably would look a lot different than if what we give someone who actually has an active cancer issue. But yes, there's ways I think you can do the prevention. And I like what you said in terms of, once a year, go through a series box for someone, like your family members that we know there's a genetic risk for. That makes a ton of sense to me.
Yes, yes. Someone's asking, does it activate dormant cancer cells?
I have to think about this. Not to my knowledge.
I didn't think so either.
Dormant immune cells, maybe, but no, not dormant cancer cells, no.
Here's one. Looking to begin integrative care for my 3-year-old daughter, working with her wonderful integrative doctor and just waiting on blood work. And so her question is, can mistletoe help heal and shrink pediatric low-grade gliomas? That's what she put in there.
We don't have a lot of great research on mistletoe and brain tumors, and even less on mistletoe in pediatric brain tumors. So that might be an area where there's a little bit of reason for caution, especially when we look at the potential for, at least initially, mistletoe therapies to cause some slight swelling of the tumors. So that's always been a big concern with brain tumors in general in mistletoe, is that initial immune-mediated swelling of the tumors that takes place, which is a good thing in the long run, but in the short term, especially when you're talking about an area like the brain where it's already a pretty tight space, a slight swelling can lead to a lot of complications.
Yes.
So pediatrics and particularly pediatric brain tumors, I think that there is a place for mistletoe, but you would need to work with someone, and there may only be a handful of us out there that have a lot of experience in that area.
Yes.
It is possible there could be some benefit there for sure.
Yeah, and for that person, you can contact us at Believe Big at 888-317-5850 and ask to speak to one of our patient advocates, and we can direct you specifically to physicians like Dr. Tim that specialize in pediatric oncology. Someone is asking here, what results can we expect from using mistletoe?
Well, I think, the central theme of mistletoe is to get the immune system behaving properly in terms of its ability to help defend your body from cancer. So sometimes physically what people will tell us is that, they initially will feel their energy will improve, their appetite will improve. Sometimes their pain, they get pain relief from it. They have a better sense of well-being, mood, sleep. So it can manifest in a way in terms of each person and different symptoms that may improve or certain other benefits that you may observe physically. But I would say most of the magic is happening on a microscopic level. Yes. And so you're not necessarily going to be perceiving that on a day-to-day basis. While you can still have some of those symptom benefits that I mentioned, most of the immune-mediated response that's happening in terms of the cancer is going to be happening sort of underneath the surface, if you will.
Yeah, and I can tell, 100% of patients that we speak to, they have an incredible quality of life and they just feel better. So, yeah. Just that alone, the stories that we hear back, and if you're following us on and you're a part of our email list, you'll hear these stories of hope that we share. And you can hear many of those stories also on our website. If you go to Mistletoe research, and then there's also testimonials. You hear testimonials from patients that we've already recorded their stories. So many patients that are out there. Some people were asking for some examples. Here's another question. Does your real quick, going back to that one, Ivelisse. The other thing to mention is that oftentimes patients will get low-grade fevers. And what's important to note about that is that, while it can be accompanied with some of the flu-like symptoms, kind of feeling run down or achy or, chills and stuff like that. Typically what I see in my patients, and I'm interested in what your experience has been since you've been on mistletoe so long as well, but typically patients that do have the fevers, despite the fever, they still feel really good. Yes.
I was curious if A, you've had any fevers with mistletoe therapy over the years, and B, if you've had that experience as well, where you have a low-grade fever, but you don't feel flu-like.
Yeah, I have the low grade. I don't feel flu-like at all. And I've done an experiment myself in the past to see how I felt with mistletoe and without it. And I can tell you my energy is better, my mood is better. I feel stronger. So,
Yeah.
and also the type of mistletoe has changed over time because people ask, about your immune system becoming immune to it.
Right.
So I've had to, check the reactions, and over the last, goodness, 14 years have had to increase my mistletoe dosage and actually change it based on
Yeah.
what's happening in my body. So have you found that to be the same?
Absolutely. Yeah. I mean, the longer you go, depending on the trajectory of each person's disease course, you oftentimes will have to make several changes, and sometimes go back to ones you might have been on in the past and recycle them, if you will.
Yes.
But yeah, you absolutely can see where the immune system can kind of get resistant or plateau if it's been on a certain type for a long time. And that's where it's great to switch up the host tree, switch up the dose, switch up even the rhythm of the injections, switch maybe to a different type of injection for a few months. Sometimes we'll have patients cycle on and off of Helleborus, which is sort of a sister drug to mistletoe. So that's where a lot of the art of mistletoe prescribing and dosing comes in. And you've been at it so long that you've probably seen it full circle.
Yes,
Yeah.
even just how it's prescribed and used, over the years. But even myself,
Yeah.
even most recently, I had to change it again
Yeah.
because the mistletoe that I was on a lower. What people may not know is that there are different properties of viscotoxins, which are the cancer fighters in the mistletoe, and then the immune boosting properties of it, the lectins that are, and every single type of mistletoe is different, and they have the
Yes.
different levels of that. And
Yeah.
so if there's a very weak patient, they may have them on a very high immune boosting side versus someone in a very active state but still strong disposition, may need a higher viscotoxin, level. And interestingly enough, before this last endometrial diagnosis, I had switched my mistletoe 2 years prior, and it went to a very a lower immune property.
Yeah.
And I always kind of think back, like, what changed? And now I'm on a higher than my other dosage that I used to be on all these 12 years, 14 years. And now I'm on this mistletoe G, which is supposed to be the most balanced of viscotoxin and immune properties. And I
Yeah.
feel great. And I can tell you that it just makes such a difference to make sure you just don't, miss your appointments with your physicians.
Right.
Make sure you're talking to your physicians and letting them know what your reactions are, how you're feeling. And that way they can give you and change your mistletoe based on what you're needing at that time.
Excellent. Well said. I mean, you're like one of the best people to have kind of moderate this sort of question and answer, because you've lived it for so many years. So I love that insight. That's great.
And another question that we get a lot is, when do you stop take mistletoe? I've never stopped, but when
Mhm.
does one stop taking mistletoe?
That's another good question. I don't think that there's one right answer for it. I've had some patients like yourself that have stayed on it for many, many years beyond a diagnosis, or beyond getting to that remission stage, because either they feel the difference when they come off of it,
Mm-hmm.
or certain biomarkers, immune markers that we're watching, when they come off of it, those things start to dip again, or they start to not look as good or as optimal as they should be, especially for someone who we're trying to make sure we reduce the risk of a recurrence as long as possible. With active disease patients, I mean, I rarely ever take them off of it. It's usually a matter of, we may have to make a change, like you said, to a different type or a different strength, or mix it up a little bit. But active disease, typically we're not coming off mistletoe at all. There might be some breaks. But patients that get to remission, or sort of that cure, if you will, it becomes a little more dealer's choice in terms of How far are they out? What are their markers looking like? How do they feel on or off of it? And each person's a little different.
Yes, yeah. And
Yeah.
I've heard, and even if especially if you have genetics like Lynch or BRCA and those type of cancer genes, that it's beneficial definitely
Right.
to stay on. And if you have overcome a later stage cancer as well,
Yeah.
to stay on it as well. So those are two
Yes.
things that I've heard over the years. What about autoimmune disease? Can mistletoe be used for autoimmune diseases?
Another great question. It can be used. However, there's a lot of context to that. There are certain, when you were talking about the different profiles in terms of the concentration of viscotoxins and lectins, you want to avoid the higher concentrated forms, usually in autoimmune patients, at least a patient that has an autoimmune disease where, if someone had Hashimoto's 20 years ago and it's been dormant and they sort of solved the issues with that, that's a different case. But if someone's got relapsing remitting MS that, could go on the flare at any moment, that's a different story. And so the problem with any immune therapy is that you run the risk of overstimulating the immune system. And that's where you can get into trouble with some of these autoimmune diseases. And so you have to be careful. It can be done, but you typically have to use the lower concentration mistletoe varieties, sometimes give patients bigger breaks in between. And also sometimes there's other therapies and medications you can deliver alongside of it that makes the immune system less likely to overstimulate. Things like low-dose naltrexone, Helleborus sometimes as well, medicinal mushrooms. So that's more of where the advanced experience of a practitioner, a mistletoe practitioner, really comes in.
Yes, definitely. Here's a question. Is mistletoe the strongest non-fiberboard treatment you can suggest, or is this part of a more comprehensive plan? I am not anything conventional because it's too harsh for me, is what this person is saying.
Yeah, I think, and I get that question all the time because I get people that come to me and, they don't want to do any conventional treatments. And they're like, is mistletoe enough? Right. And typically my response to them is cancer usually does not respond to just one thing, unfortunately. And so when we're looking at trying to be as successful as possible and give people the best chance at a good long-term outcome, the best chances usually come with combining multiple different angles of hitting it from. And so the immune system, while I think mistletoe is the number one thing you could do to get the immune system dialed in for cancer, there's many more aspects that need to be addressed usually. You have to address inflammation, you have to address toxins, you have to address the gut, you have to address mental emotional issues, stress. Mistletoe doesn't do all of that for us. And even then, when all those things are dialed in, sometimes you have a very aggressive cancer that needs traditional treatments as well. And so I see it as a much more multi-pronged approach because cancer, as you know, can be quite diabolical. And we oftentimes need a very deep toolbox to deal with it.
Yes, yes. And, somebody's asking about the results on prolonging life. We've seen many, many stories on this where patients were given weeks and months to live and they've lived out years. Have you found that in your practice as well?
Every day.
Yes.
Every day. I mean,
Yes.
I continue to be amazed at, the resilience of patients when they are working on the right things, when we give them a good game plan and we execute. I mean, to me, I always hated the fact that that a lot of doctors like to give patients expiration dates and say, oh, well, this is how many months you have to live and here's the statistics and all that, because to me, I've never seen any of those be right.
Yep.
I mean, on both sides. I've seen sometimes where it was like, oh, this is a slow growing and you got years and don't worry about it. And then 2 months later, they're gone. I know that sounds scary, but I've seen that more often. What we see, obviously, people I work with is that they were given, a not so good expiration date, 2 months, 6 months. This is aggressive. And then we get to working on all the things we can work on. And 2 years, 3 years, 4 years goes by, and their oncologists are just flabbergasted. They don't know what to say.
Yeah.
So we see that all the time.
Love those stories.
Yeah, I love them too. That's what keeps the fire burning for me, for sure.
Mm-hmm. Is it necessarily a good or a bad thing that someone continues to react to a lower dose of 30 milligrams of sub-Q? Says, my goal was set at 200 milligrams, but have been continuously reacting to the 30 milligrams for quite a few months now.
Well, generally speaking, that's what you want, and I've seen patients that have reacted to one dose for a year, sometimes 2 years. So it is possible. But I would say beyond that, the reaction is very telling usually, but also should be monitoring how the patients are feeling, what's happening with their disease, what do their biomarkers look like. Mm-hmm. So there's lots of other context and information we can look at to say, because I have seen cases where patients were still getting reactions, but based on other information, we still made a change.
Okay. So
the reaction in and of itself is not the whole story. It's a very strong guiding principle, but a good mistletoe prescriber and practitioner will look at more than just the skin reactions.
Okay. And what about something to put on? It says, can you put anything on the reaction to help the itching?
The number one thing I tell patients is ice.
Mm-hmm. Okay.
I don't like putting any sort of anti-itch cream, steroid cream, Benadryl, that type of stuff.
What about calendula?
Yeah. Calendula, yeah, absolutely. You can put calendula on there. If it's really, some people get not so much the itching, but they become really painful. In that case, you could put arnica cream on there. So the homeopathic ointments, I'd be fine with, but the more over-the-counter, low-dose, steroid, hydrocortisone creams, Benadryl creams, things like that, I would avoid. Ice usually takes the itch away.
Okay, I didn't know that. That's a great tip.
Yeah.
Aw, someone said, so great that you're healthy again. Thank you. Me too. I'm so grateful.
Yeah, praise the Lord.
Praise the Lord. Is a consistent, how does a robust immune system typically react to the mistletoe injections? A robust immune system, not a weakened one.
Well, again, we're typically talking about mistletoe in the context of cancer.
Yes.
So if someone has cancer, I guess there is a chance that they could still have a pretty robust immune system. But it may be focusing on the wrong things.
Okay.
Cancer, our immune system is a Swiss Army knife, okay? And with cancer patients in mistletoe, we're really trying to sharpen just one of the many blades that the immune system has to offer. And so you could, the rest of your blades, the rest of your Swiss Army knife might be working really well. But most of the time, patients that come to me with cancer, that Th1 dominant or that cancer, blade on the Swiss Army knife really is in trouble, and we need to get that dialed in. And so that would be my first response to that question. But let's just say, for instance, it is working well. The mistletoe can only help. It's not going to cause any sort of regression of that already robust immune system. It can only help close the gap on whatever's left for room for improvement.
Okay, that's a great answer. And here's another one we get a lot is, can it be taken along immunotherapies?
This is another great question, and one we get a lot. And yes, I'm here to say officially that it can. Again, there's some context, sort of like with the autoimmune type diseases, where you can run that risk of maybe overstimulating the immune system. So we generally have patients use, again, lower concentration forms of mistletoe alongside immunotherapy drugs, especially in the early stages of their immunotherapy treatments. And just for everybody out there, when we're talking about immunotherapy drugs, we're talking about the drugs like Keytruda, Opdivo, Yervoy, rituximab, things like that. So pharmaceutical drugs that have been coined immunotherapy drugs because they sort of ramp up the immune system in a way that targets certain receptors on these cancer cells. Okay, the way I explain it, actually, a great analogy. If we're doing okay on time here.
Yes, we have a few more minutes.
Something I tell my patients, an easy way to explain this is if you think of your immune system like a race car, okay, and every time that race car is rolling around the track, it's basically getting rid of cancer cells. These immune therapies are basically like sticking a brick on the accelerator of your race car, okay? And so all those things are going to do in different ways, but essentially what they're doing is they're trying to make your race car go faster, which is great if it's in good working order, right? However, what we see is a lot of people come to us and their race car, it's been due for a service for a long time, okay? It's not, the handlebar or the steering wheel's falling off, the brakes are, shot, the tires are shot, transmission needs to be replaced. There's not a lot of gas in the tank, however you want to describe that analogy, but their immune system is in really bad shape. If you hit the accelerator on a car that's in bad shape, most of the time you're going to see it kind of slam into that first turn, right? It's not going to run that race very well. So what Mistletoe does, and to a certain extent, a lot of other integrative therapies that focus on the immune system, is they get your car in good working order. Okay, they're making sure there's good gas in the tank. The spark plugs are all changed. The oil's topped off. The tires have got fresh tread, so that when those immunotherapy drugs drop that proverbial brick on the accelerator, that car's ready to run. And then you get the sort of the synergistic effect of both of those. But it's always best if you know you're going to be getting into immunotherapy, again, if you know you're going to be running the race, get the car in working order first.
Yes.
And we've had several patients where they've been through multiple lines of chemotherapy. They've really been beaten up. Their immune system's already been tanked from prior treatments, radiation, chemotherapy, you name it, steroids. We have them come in and we do sort of a mistletoe intensive. And that's where you might want to use maybe an IV mistletoe, because you can really get their race car in good working order in just a few weeks that way. And then they can go and do the immunotherapy and they can throw the brick on the accelerator and have a better chance of running that race.
Wow. Well, I loved how you explained that, because sometimes the medical terminology can just be way over our head. And so
it's way over my head too. That's why I always try to, resort to analogies, because it helps me think about it easier that way too.
Yes. Yeah. Well, we appreciate it for sure. Here's a little controversy that, we get answers on both sides of this, and so you're one of the top experts, so maybe you can clarify this. It used to be the thought that you could not do mistletoe and high dose vitamin C on the same day, because IV vitamin C is cooling where mistletoe is heating, and they thought that it would counteract it. But now they're saying that it is okay to do both on the same day and even in the same bag. What are your thoughts on that? And what are the research showing?
Well, this has been kind of a hot topic for the last few years amongst the integrative oncology community. And I've talked to colleagues that I respect that are on both sides of it, and I don't know that there's necessarily a definitive answer on that, to be honest. I would say that my personal preference is for patients to separate those. And there's not any hard data that says that you have to do it that way. That's first and foremost. And so when you see doctors that are doing them on the same day, or even putting them in the same bag, to me, there's a lot more risk with that. I don't think you should put anything in the same bag as a mistletoe IV, whether it's vitamin C or B vitamins or anything. To me, you should let the mistletoe do its own thing. However, doing them on the same day, I don't think they necessarily cancel each other out or have any sort of negative effects. My bigger concern on that front is just the amount of biochemistry that's happening in the body with those two types of treatments on the same day, especially in a patient where, they've also got a very, maybe possibly advanced cancer. So
Yeah.
a lot of biochemistry going on there. It could be a lot of potential things in the mix. I think there's more questions than answers when it comes to that subject, but right now my preference is for patients to separate those and at least do them on separate days. But at the very least, I would not put them in the same IV bag.
Okay, well, there you go, guys. There's your
Yeah.
answer. Yeah, and I think that a lot of practitioners too, patients are running from appointment to appointment and having to return on another day and the cost of it. So trying to balance, the pros, the benefits, but also the cost of having an additional IV on another day when you already have the, set up and ready to go can be an issue for patients as far as the cost factor. So I know that that's some reasons why some practitioners do it on the same day.
Yeah.
And okay, if other people have any other questions, put them in the comment because we're about to close up. If you had any last minute questions for Dr. Lucas while we have him here online. But one other one that came through is mistletoe therapy for all cancers?
I think so. I think that there is a type of mistletoe for all cancers and for all patients. It may look different. There's nothing about mistletoe that's cookie cutter. You know that by now. It's a very individualized type of treatment. And so in that same vein, I think that for every individual out there, there could be a way of giving them mistletoe therapy that would benefit them. But that's where really working with somebody that understands proper mistletoe prescribing and management. For everybody out there, I think there's a potential you could benefit from mistletoe, no matter what stage, what type, what other treatments you're doing alongside it. There's likely a place for mistletoe in there as well.
And here's one that we hear a lot, but it's not one that I have experience with. I've always known of the sub-Q and the injections, but some people are using oral mistletoe. Someone asked if you can afford, is it still worth doing, or is that have anti-cancer properties by doing the oral version?
Unfortunately, it doesn't seem to, and it even runs the risk. Ingested mistletoe products, depending on the strength and type, actually you can see more adverse effects with the oral type versus the injected extracts. It can cause, at certain concentrations, you can cause some liver issues with ingesting mistletoe. Some people may not know it, but most mistletoe varieties are somewhat poisonous plants, which is, again, we get most of our best medicines from somewhat poisonous plants if they're extracted in the right way.
Exactly.
But ingestion orally of it does not seem to produce the same immune stimulation, and it does seem to increase the risk of some adverse effects in the liver.
Yeah. Someone's asking a question about insurance coverage, and that's one of the things that we're trying to do at Believe Big. Is one of our goals with the mistletoe clinical trial is to go through all three phases, not just so that it can become a part of standard of care oncology, but so that it can be covered by insurance. And that's what we're actually raising money for today, and throughout the years is raising the funds needed. Phase 2 we're gonna need to raise $1 million in order to make phase 2 a reality. And that is our long-term game. We want to help the patients of today by providing grants and help to see physicians like Dr. Timms that's with us today. And then also the long-term, which is helping those of the future by making this affordable for all and not just those that can afford it. So, which leads me to today, which is Founders Day, Believe Big's birthday. And if you at all have benefited from Believe Big, or if you would like to pay it forward to someone else who's in the middle of their battle, or share this video with someone else that might be able to help us, you can just text Believe Big to 53555. Again, it's Believe Big to 53555. And the donation of any amount will help us to run our programs and help patients with treatments that work and are effective and can help them throughout this cancer journey. You could also go onto our website at believebig.org/donate and donate online as well if you prefer. Dr. Lucas, we have someone who's asking if you're taking new patients.
I am taking patients. I'm currently offering virtual consults to patients all across the country. So no matter where you're at, I can work with you. The easiest way to request a consult is through my website, which is www.drlucas.org. doctor is spelled out, doctorlucas.org. And there's a form on the website you can request a consult through. And I'm not sure how many more patients I'll be accepting, but right now I am accepting some, yes.
Wonderful. That's so good to hear. And for those of you who are in your cancer journey and you need some assistance, please contact us at Believe Big. Again, call us at 888-317-5850 and ask to speak to one of our advocates. That if you're not able to get in to see Dr. Timms, we also have other practitioners within our networks that have been vetted that know mistletoe and that can help you or your loved ones. So make sure that you connect with us with that. So, okay, let me see. I'm going to do one more. Let's see here. Let's see. There's so many. Okay.
Yeah, and I'd be happy to, just so you know, since there's a lot of questions, we can take more, but when this posts, I'm assuming this will post to our pages.
Yes, wonderful, yes.
If people want to put questions in the comment section of that,
great.
Over time, I won't maybe get to it right away, but over time, I will try to go to that comment section and answer those questions as well.
Oh, great. Well, thank you so much for your time, Dr. Timms. We so appreciate you joining us today. This was amazing, very informative, and we just appreciate it. And for those of you who are in your battle, just know we are praying for you. And we pray that this holiday season that you would receive the gift of healing. And Merry Christmas to all of you.
Yeah. Happy holidays. Bye.